Do your varicose veins make you hate the way your legs look? Do you wish you could wear a bathing suit, shorts, or a dress without feeling self-conscious? Do you struggle with leg pain that prevents you from enjoying the life you really want to live? Well, you're not alone. More than 210 million people will suffer from varicose veins and complications that can result in leg ulcers, pain, and embarrassment. And if you have varicose veins, you are 30 times more likely to have blood clots. Meet Dr. Thomas Ashton, #1 best-selling author, CEO of Ashton Vein and Laser Centers, and physician with more than 40 years of experience in medical and surgical venous treatments. Dr. Ashton educates patients and physicians nationwide on the latest state-of-the-art non-invasive treatments that eliminate the risks of varicose veins. And today, he's going to share some of his most powerful insights that will eliminate blood clot risks, leg ulcers, swelling, and ugly legs. Please welcome Dr. Thomas Ashton. Well, welcome, Tom. Nice to have you.
Thank you. Good to be here.
All right. So you are in the 3rd decade of your general surgery practice, and you've performed countless vein stripping operations, and you've made an interesting discovery. So tell me about it.
Well, the discovery is over the many years that I've done this, the vein stripping operation, which is the main operation that's done worldwide, is not only brutal and bloody and requires general anesthesia, but it also has an 85% recurrence rate. So if you do a case now, 3 years from now, that patient is going to be back to square one with a recurrence. With that knowledge, I started to investigate the possibility of maybe there's another way of doing this. So that's when we discovered some of the minimally invasive procedures that we perform now.
Okay, and why don't you describe those, but more importantly, how many vein treatment operations have you done, or more importantly, how many legs have you treated in your history?
Well, if I would think back, over 5,000 patients, which means over 10,000 legs.
Okay,
so
you've got real history to
Yeah.
back this up. So when you learned about this new treatment, there weren't any formal treatment programs, and you've actually had to build and figure a lot of this out yourself, and also find the biggest and most impressive giants of the specialty. So talk a little bit about how you built your clinics around this expertise.
Well, in my investigation of what we were going to do about this problem, I was very fortunate to meet some of the giants in the field. The one I was mentored by is Dr. John Mariallo. He's past president of the American College of Phlebology. And his associate was, and still is, Joseph Zygmunt, who is nationally known and probably the most experienced technician for venous disease in the world, literally the world. So working with these gentlemen, I was able to work with them and develop 2 additional clinics that they were building. Then after about 3 years of doing that, I decided to return to my Florida and start my own vein center.
Okay, so the bottom line, I think what's really important is, besides the fact that you've been doing this for a long time, you've worked on a lot of legs, you went out, you found a better strategy, a better system, you met the people responsible for it, and now you're actually in business with them too. So it just goes to show, I think, the character and also the background you have.
Well, it was a pleasure all the way because we were developing something that was very unique. It was solving a problem that most physicians aren't aware has been solved. And that's why I like to teach other physicians how to do this. And we are actually doing that through the Vein Center Academy, which we're establishing to pass on this expertise to other physicians. And that's going to help solve and eliminate this problem of vein stripping, because a lot of vascular surgeons still continue to do vein stripping. And it's, in this day and age, it's really not appropriate.
Right. Well, why don't we talk a little bit about the people who you've worked with? And I know we've got some before and after pictures, one of them of a client named Tony. So why don't you talk about what was going on and what he was actually suffering from and what you were able to do for him?
Right. Tony came in because he was having trouble square dancing. And as you can see in the photograph, his legs were horrendous.
Definitely, definitely are.
This case represents one of the end stages of venous disease. It's called ulceration. They call it stasis ulceration, and it has to be differentiated from arterial ulcers. But we do that by performing a very easy, non-invasive ultrasound scan. Tony's scan demonstrated that he had blood flowing the wrong direction down his leg when it's supposed to flow up the leg. And we call that venous insufficiency. So once we discovered that, we could understand then why he had undergone 5 years of treatment for his ulcer without any improvement. So as you can see in the picture, the after picture demonstrates that the ulcer is closed and healed up. The discoloration in his leg is subsiding. And unfortunately, this particular gentleman moved to North Carolina because that's where they really liked square dancing. And we lost, the final picture is yet to be seen, but I'm sure that he's doing very well based on his progress at our clinic.
That's impressive. And how long does it typically take for someone to, from the time they meet with you, they actually have the treatment, and then are seeing some sort of noticeable results?
Well, it depends on the stage at which we see them.
That was obviously very late stage for him. That's the extreme,
That's
clearly.
the extreme. So it took us 6 months to get him fixed up just like he was.
And he was back to dancing again.
Back to dancing.
And not wearing the stockings.
And here's another little interesting fact. He was 95 years old.
Wow.
Yeah. So originally this thrust toward developing a minimally invasive procedure was to perform on patients that were unable to undergo general anesthesia. Then we found out that it worked so well on those patients that why wouldn't we allow this procedure to be done and treat all patients that way. So that's what we do now, no vein stripping.
It's very impressive. Yeah. Now, I know you've also helped patients with restless leg syndrome. So first of all, what is it and why does this process work so well? And what's the distinction between venous legs and restless leg syndrome?
Well, restless leg syndrome is something you don't see when you do a physical examination. That's part of the extensive history that we take to make sure we know what's going on with that patient. They'll tell us exactly how their legs feel, and then we see how they look, and then we do a diagnostic test to see why that's happening. Restless leg syndrome is one of the phenomena that we see in venous insufficiency because blood flowing the wrong direction is causing fluid changes in the lower leg, and it can be also associated with edema, which is swelling. So you have a swollen leg, and you have a patient that can't sleep at night because their legs are all over the place. And so it has a very long-term bad effect on their health. So when she came in, we suspected this after taking the history. We did a scan, and sure enough, we saw that she had venous insufficiency, blood flowing down her leg when it's supposed to flow up your leg in your veins. So we corrected that situation with our in-office laser techniques, and within a matter of 8 weeks, she was on follow-up. She said that she no longer has leg cramps, which was another aspect of this. Leg cramps and restless leg syndrome, very common with venous insufficiency, even if you don't have visible bulging varicose veins. So that's another point, because a lot of physicians looking at her legs would say, take potassium, take this, take quinine, whatever, and they don't really look for the main problem, which is the venous insufficiency. That's why we like to educate physicians on this specialty of phlebology, which has really become a stepchild in medical training because it's almost ignored. And that's why physicians don't recognize it when they should.
Very good, very good. So besides making a big difference in people's lives, so you work with venous treatment for people who've got varicose veins, you've got restless leg syndrome, but what about spider veins? What do you do with people who are suffering from that?
Well, we have patients that come in with a cosmetic concern. And our initial evaluation is an in-depth evaluation so that we can determine whether those spider veins are in fact just cosmetic or whether there's a medical condition called venous insufficiency as well. So we'll examine that patient and do an ultrasound scan. If there's no reflux, then we can treat that patient with cosmetic sclerotherapy, and they get an excellent result.
That means it just they
They
start
go away.
dissipating away.
They go
Okay,
away.
That's great.
Now, most patients, because of heredity and estrogen, and will need, after maybe 6 months to a year, a touch-up. But they would come in for the office for 10 minutes, and we touch them up, and they're back to being beautiful again. So, it's a matter of making the right diagnosis, which I like to emphasize that because if a doctor doesn't make the right diagnosis, then the doctor's not going to give the right treatment. So you have to be very thorough and comprehensive about your initial evaluation if you're going to supply that patient with something that's long-lasting and useful for them.
It's something else that I think is very important is the downtime. People are wondering, well, what's the downtime for any of these treatments? And that's really the best news of all.
Well, to compare the downtime with these procedures to vein stripping, for example, and I'm a general surgeon. I did hundreds of vein stripping operations in my other life. Those patients would normally be in the hospital for 2 or 3 days, general anesthesia, tremendous amount of blood loss because you're making a lot of incisions over huge veins, very unsightly scars on their legs, and then they would go home and be in bed for a couple of weeks. And of course they would call you with pain and you would give them pain medication, and then they would get constipated. And pain medications makes you constipated. So I could, as a general surgeon, I would get calls in the middle of the night, I think I'm obstructed. So go see them in the emergency room and find out it's just the opioid medication.
Yeah.
And of course, in those days, we had no concept of how addictive opioids were. So now, to compare that to what we do now, they walk in the office, they are diagnosed, they have their procedure and go back to their normal activity the very same day, or in some cases with heavy construction workers, the next day they go back to work. And even the day of the procedure, we ask them to walk for 30 minutes. And there's no bleeding, there's been no blood clots, no hospitalizations, and the procedure has been universally effective.
That's fantastic. So now you're available to work with patients. You're giving away your book, which is How to Stop Ugly, Painful Legs. We'll talk about that in a moment.
Right.
But you've also got your Vein Center Academy where you are educating and training doctors on your system as well. So let's just talk a little bit, first of all, about your #1 best-selling book and where they go and how they can learn more about you.
Okay, this is a very important book because patients are not informed as to what they have, and doctors don't tell them what they have because they don't know what they have. So I'm telling my patients, I give this to my patients when they come in, or you can obtain this book online at ashtonveincenter.com, and we'd be happy to send that to you. But if you read it, and that's the secret, you got to read it, you'll know more than most doctors do about venous disease, literally.
Very good, very good. So on your website at ashtonveincenter.com, they can learn more. First of all, get the book, learn more about you, find out if they're a right fit for the procedures, but also if they're a doctor, they can learn more about the training as well.
Right, and doctors can go to the VeinCenterAcademy.com.
VeinCenterAcademy.com.
Right.
So you have your choice right now. So if you're a patient looking to get a copy of How to Stop Ugly, Painful Legs and learn more about the procedures and how to work with Tom, you head on over to AshtonVeinCenter.com. Or if you're a doctor, you want to learn more about the training, you head on over to
VeinCenterAcademy.com.
That's right, VeinCenterAcademy.com. Thanks so much for watching, and thanks for being here today.
My pleasure.
All right.